After Saturday's alarming increase of 3,198 new COVID-19 infections, the Sunday Times lead with COVID-19 surge in Eastern Cape could trigger second wave in the new year, experts warn. Well, the Daily Maverick quoted doctors from the same region saying the re-emergence of SARS-CoV-2 was driven by poor compliance and the regulations by the communities, which include failure to wear masks in the public, lack of social distancing and routine hand washing or sanitization. And what you should tell people now, one said, is that we are underprepared and people will die. Well, these are just some of the headlines coming out yesterday in the Sunday newspapers, but the figures of new infections on Sunday were slightly lower. They came in at 2,563. Let's get an update now from the Minister of Health, Dr. Zweli Mkhize. Minister, thanks for joining us. It's always good to have you on the show.
Morning, Leanne, and all the viewers.
Minister, what are you feeling at this point in time? I mean, the numbers are creeping up. You've just completed a visit to the Eastern Cape. What is your sense of what's going on with COVID in the country?
There are indications of cluster outbreaks and resurgence in two provinces mainly, and that's the Eastern Cape and the Western Cape. In the Western Cape, it's still a bit less, but in the Eastern Cape, it's gone much higher, requiring us to act quite swiftly and also quite decisively. In the rest of the country, we're picking up the numbers are creeping up in KwaZulu-Natal and in the other provinces such as Free State, Northern Cape, those are still going down. So I think our biggest concern as we sit now is that we need to contain what we're seeing in the West and the Eastern Cape and then make sure that we prevent it from spreading to the rest of the country. So as we speak now, we have a resurgence in the Eastern Cape, focused mainly Nelson Mandela Bay. If you look at the figures that you've quoted, already 2,500 in a day are higher. Sometimes it goes up to about 3,000, sometimes a bit less. Just depends on the variation on the day. But average now is indicating that we are moving up above the 2,000, 2,005. And that those numbers are an indication of increased load that's coming up in Nelson Mandela Bay, which Eastern Cape will be about 43 to 55% of the daily positive cases will come from Eastern Cape, and then about 24% will come from the Western Cape per batch in a day. And then in Nelson Mandela Bay, that will be accounted for about 45% of the Eastern Cape number. So that definitely increased numbers, and we have to really focus on what can be done to contain those numbers.
Well, it certainly is. I mean, the numbers are looking a little bit worrying. I mean, we were sitting, I think the biggest increase was last week where we saw in excess of, was well over 3,000. It was sitting close to 3,500 new infections. And that must bring alarm bells, because when you put it into a grouping, I mean, there's way over 20,000 infections in a week, and that in terms is a big jump. I mean, we haven't seen those since South Africa went into a hard lockdown. Now, let's just have a look particularly at the Eastern Cape. Is the Eastern Cape, you say a resurgence and hotspots, is this not classified as a second wave as yet?
Well, we can call it a second wave when it begins to sweep across the province and across the country. But when we're dealing with it at this point, it's more or less the same thing. Basically, it's a hotspot, which means the numbers are higher than can be tolerated, and that we need to act on it. And so it doesn't quite change the definition. But when we talk about the second wave, it's when we're looking at the whole country being swept, like we saw around June, July, August earlier this year. So all we're saying is that right now there is enough reason for us to start activating all our plans and really going on full steam prevention as well as containment mode. It is serious. It's not something that we can wish away. But if for some reason we're able to all agree to work together and contain it, it need not materialize into a full-blown wave of the whole country. It can be contained in that area. Not so easy, but nevertheless, it needs to be focused.
Yeah. You know, there's also a lot of worry around about the second wave coming after the festive season? Because, I mean, even in one of our inserts, I think it was in KwaZulu-Natal, that's where you are right now, they were giving a briefing and different health clusters sitting together and talking about the fact that obviously when you do go to social places like taverns and nightclubs and big gatherings, this is where you see that, you know, a super spreader event may result, and also people come together drinking, you know, they drop their inhibitions and they have fun. Describing this as a tough year, we all need to have fun, but this is where alarm bells start going off. So are you worried about the festive season?
Yes, we are worried. We look at the numbers as they start moving up. We've been looking at the KwaZulu-Natal numbers. Are still very, very, very low, but the trend is not encouraging because it's slightly showing numbers that are slightly going up. Not enough to define them as anything yet, but indicating that we have to watch very closely. We issued that warning about Eastern Cape a few weeks back, and Western Cape. We are actually seeing now those numbers showing, you know, full blown increase. Now, we are worried about the festive season because what it basically means is that people are going to come together, they enjoy themselves, they don't use sanitizer, they don't use masks, they share glasses, they share smoke, they share all those things. And in the process, they'll end up with a situation where this thing breaks up into a big, excuse me, it breaks up into a big, hotspot and outbreak. So we have to warn people about that. Now, during the festive season, everybody thinks that it's time to enjoy. That's when things are likely to actually get out of control. And the real risk is that by the end of December, beginning of next year, we'll have had so many of these super spreader events that in every one area where people have actually been complacent, the breakup happens. And when it happens, begins to spread to more areas and it begins to go to different provinces. And when people go back to work during the beginning of the year, now you will see outbreaks all over the country, mainly because people would have come from wherever they've been, they were exposed to the super spreader events, and then they're carrying the infection back to where they are working. And it actually is now a risk that we must be very conscious.
Yeah. I mean, I saw a headline coming over the weekend. I mean, we opened up the please have a glass of water or something, whatever you need, Minister, just to get yourself back. And I mean, we still have to, you know what, before I ask any questions, I'm going to pause some questions because I actually want to speak to you. How are you feeling? We know that you had COVID. We know that you've recovered. But how are you feeling? So many people actually speak to the long-term effects that are actually, they sit with you for a while, and it's a bit worrying. Minister, how are you? How are you feeling at this point?
Well, thanks for asking. I'm well, and my wife is well, and we want to thank all the South Africans who have given us all their, good wishes and their support and encouragement. It didn't last too long. In our case, I think we got the lighter wave of it, and the infection had some symptoms, mainly muscle body weaknesses, loss of appetite, and it didn't give us the severe kind of symptoms that we have seen in many other places. But it does last, and certainly when you go through it, you will know something has gone wrong in your body, and it can be quite heavy. But there is a definition now which is being used where people are talking about short COVID and long COVID. This is mainly because the symptoms tend to either dissipate within a short space of time. In this case, they talk of it as short COVID. But there also is this prolongation of symptoms where for weeks and weeks, people still feel the symptoms, they still feel the weakness, they still feel the tiredness, they still feel some of those challenges. In some instances, people will for several weeks still have cluster outbreaks where, cytokine storms, where they basically get a huge reaction of the body that makes their body even weaker and affects their respiration and so on. And so you can't say, if you feel better now that it's gone completely. Yeah. It might just recur, and that's really what people have experienced. And so this term of long COVID basically now refers to people who have had the infection. It seems to have cleared, but over a period, they still find that the symptoms are coming back. The body is not quite what it used to be. The energy levels are not up. And sometimes you get so much of symptoms, you feel you are sick that time, then you get better, and then it keeps coming on and on. Yeah. And it lingers for a long time, and that's what we got. But in our case, we haven't got that, but we have had that described already in our literature and a number of people that we talked to.
Yeah, and that's something I think people must always remember, is that, you may get over it, but it's that long haul that can be debilitating in some instances. But again, I'm glad you're okay, and your wife is also doing well. So, Minister, getting back to the question that I was saying in terms of some of the headlines that have been making their rounds, and there has been talk of heavier lockdowns in different regions. Is this on your sort of mode of ammunition? Could that be something that you may be discussing with the presidency, with the decision makers, to bring about to the festive season to stop spread? Because these second waves and kind of a big spread in the country has been predicted. Some saying January, February, others saying it's sooner. But are there tools you're going to put in place over the festive season to try and prevent this?
We wouldn't like to talk about lockdown, because what you understand with the lockdown, excuse me, it's something that differs, because we had lockdown 5, level 4, level 3, and so on. So it can be a little bit tricky to start talking lockdowns. In this case, that's not what we're discussing. However, I think it's important to bring in some various kind of restrictions to encourage particular support. For example, if you go into some of the areas such as Nelson Mandela Bay, we have got areas where we clearly can see that there are super spread activities that are going on. And it's important to start looking at the size of meetings that people are having, looking at whether people are focusing on distancing, the use of masks, and how to encourage that behavior in malls. I went to Motherwell Mall, and the place was packed, and I saw the efforts of the shop owners to try and contain the numbers. It requires a lot more now than that. And we've had reports of parties with students and with young people in various areas. We've had reports of taverns where people drink throughout the night, and when there was a curfew, people would just close the door or close the gate, and then they continue inside as though nothing had happened. Now, those kinds of things need to be discouraged. And therefore, I think we need to look at how to review the numbers of people who must attend funerals and meetings, and also, how people can continue to be protected whilst they could have been using alcohol. There's also been a complaint from the hospital that they're overwhelmed by the trauma related to alcohol. So we have to look at what possible restrictions would assist to alleviate the pressure in the hospitals. And we have to make sure that wherever people are in a public place, people take responsibility to use masks for hand washing, sanitizers, and all of that. So all of those issues now have to be put into the balance. From what we have been through, we just identify the main risk areas, and then, of course, the Coronavirus Command Council has to sit through and look at what would be the best supportive mechanisms that will help to reduce the spread. Because I think it's important for people to understand that, you're not going to insist that you want to enjoy and then end up in a hospital or landing with someone else now having lost their life because, you insisted on enjoying yourself. So that has to be looked at. I think that we do need to send a kind of signal to the communities that we are there to help to, support particular behavior, and therefore certain restrictions would have to be brought in. And those restrictions, would have to deal with the question of numbers of people and also the consumption of alcohol and so on. But what exactly those would be, it would be coming out when that meeting has been done. But the main issue right now is that we can see the pressure. I went to the casualty in Livingston Hospital, and the doctors and nurses took me through to show me what kind of pressure they get when people come in with motor vehicle accident, when they have been, assaulted with all sorts of injuries, stabbed chests, and so on, which basically means the attention that you want to give to the people who have, COVID-19 is affected. Then we went to the other side, on the outpatient side, and looked at how so much pressure that they are going through. There's no doubt now that the pressure in the community has to be somehow alleviated so that the hospitals don't feel that much pressure.
Yeah.
So all of these things are things that we have to take into account as we look at the containment measures. But those are mainly for the Nelson Mandela Day. But of course, we hope that everyone will be able to get the message that there is no, we're not out of the woods or in trouble if we're not able to be able to focus on containment measures such that this thing might spread into other provinces, now necessitating additional actions in other provinces. Although nothing right now is on the table, but I think it's important for people to understand that you rather save lives than actually insist on the right to enjoy yourself.
Yeah, I think that's good advice, because people are making plans. They are wanting to go away. They are wanting to organise their lives for the festive seasons, like having families over for lunch, or leaving the provinces, going to the coastal towns, or going to other areas just to enjoy their holidays. So, I mean, the advice that you can give people is that, yes, indeed, you've got to be vigilant, but it doesn't appear that government will put anything in the way of those things happening at this stage. Or could it change at any given minute?
We go by numbers. As you know, we follow scientific evidence. What numbers show us, we'll respond to that. Okay. And so if we find the numbers are increasing, we'll act. You can't say, well, we said there will be no action, and then we see the numbers are getting out, because it's about protecting people. One main advice I would give for people is that, yes, it's festive season, but please be careful. If you enjoying groups, and still keep your distance and use your mask. The sharing of glasses and cigarettes and all of that needs to be stopped. And that people need to understand, the more they enjoy themselves and take into alcohol, the less they are able to prevent the spread, because people tend to drop their masks, they are no longer careful, and so on. So we're saying we'll enjoy our festivities with a lot more restrictions imposed by ourselves, so that our being careful is going to help us. But if it doesn't work, it's going to mean that the whole country is going to flare up into a whole second wave of a full-blown kind of resurgence of COVID-19 throughout all our other provinces.
Minister, 2 questions. I know I've got to let you go in literally a minute, so I don't know how I'm going to ask you these questions, but I'm going to try. Gauteng had a big question mark over it. For 2 days, we never saw any of the numbers coming through. Now it seems that there is numbers coming out of the Gauteng province, because, at one stage there were about 200 cases or somewhere there. And then, of course, we stopped reporting on them. What was the problem? What's going on with the reporting within Gauteng?
Well, we will find these problems every now and again. Our numbers are as good as those who collect the data. And the data is as good as the details that are given. So if there are not adequate details, then you don't know how to classify the patients who are positive. And sometimes you find that one specimen will be tested and then retested, and in the process it might be counted twice. So all of that were the challenges. We've actually sent a team from the MEC. We sent a team to say they must go and help to clean out their data. So every now and again, when we suspect that the numbers aren't matching up, we will then go and find a way to get it corrected. So this is what happened in Gauteng. Nationally, we've also got another process. For example, you will notice that when I was in Motherwell, we were actually doing public testing. So we go to public place and test people. Now, those tests need to be counted, but they're not the same as the tests that have been done in the laboratory. So what we do, we've now brought in a whole new system that then starts to integrate the test in the community and the test that we're doing in the laboratories. Now, if you put these two together, excuse me, if you put these two together, you suddenly find that there are retests, there are duplications. So in these few days, we're actually even at national level cleaning up the data in a way that will actually change the total numbers of tests that have been done, because we want to know how many tests were done and how many people were tested. Those are not the same thing. So one person can have 4 or 5 tests, But in fact, if you want to know how many people have been tested and tested positive, you then count them separately to the number of tests that have been done. Then you also have to make sure that you realign the tests that are coming from outside South Africa so that they don't get to cloud the South African numbers. So these figures, we will actually in the next day or so announce this so that you will see it adjusts the numbers. So you find that the total number of tests that we are now reporting might be different to what was reported before, simply because we've picked up people who have had a test in the clinic and then a test in the hospital and then a test in the community, and then we have to reduce all of that to fewer numbers of tests based on the numbers of people tested. So all of this, every now and again, we have to keep re-auditing our numbers to make sure they're accurate.
Okay, good. Minister, thanks very much. You've got to run. I know that you have another appointment. But on a closing note, why are we not seeing the tests conducted? The last 3 reports that have come out, the tests, total tests conducted are not there. Any reason?
Yes, that is because we have to go through this arranging, we call it the cleaning of the data and the deduplication, and then we're integrating antigen tests with the PCR laboratory tests. That once that has been done, we will then you'll see the numbers will change. But the changing of the numbers doesn't make them inaccurate. It just means that we've picked up everyone who's been tested. So if you test anywhere, want your ID number, want your phone number, just to make sure that if you got Zweli Mkhize, it takes a long time to know whether it's Zweli Mkhize, Zweli Mkhize, or Zonke Mkhize, and so on. So it takes a while. You have to. That's what takes the problem. But once it's been done, we'll release the numbers again.
Okay.
It's just a cleaning up which we have to do, which is a normal auditing process that we have to go through internally so that the numbers are accurate.
Minister, thank you. Thanks very, very much for your time. I know there was so much more to talk about, but we've covered a lot. But we do thank you so much for your time, Dr. Zweli Mkhize, giving us an update on COVID-19 and the stories surrounding that, and a lot of talk of different restrictions being implemented, particularly in the Eastern Cape. Well, you heard the Minister, it may be an area-specific restriction, but in terms of lockdowns for now, the numbers are not necessitating anything. But like he said, they run by scientific data, and if it's needed, then they'll have to make those decisions. All right, quick break. We'll have the headlines after this.